I'd like to talk to you today about a personal experience that I've had with my own health. I have had in the past a condition that I'm sure many of you have heard of. It's called gastroesophageal reflux disease. It's abbreviated GERD, mercifully. And many of you may actually have this or have taken medication for it, and it really can be quite miserable. This is experienced many times as what people will call heartburn, and I have had this condition for, I would say, most of my adult life. It's often associated with abdominal obesity, and we're not exactly certain how that works. At least I'm not exactly certain. I've always interpreted that as simply there's more fat in the abdomen, it pushes up on the stomach, and then there's more reflux. But I think there's more to it than that. But for many years, I was treated with a medication that you might know. It's called omeprazole. And I would take this periodically, and then I'd run out of it, and then I'd end up getting symptoms back and get back on it again. And a number of years ago, I had an episode of very significant lightheadedness. And this persisted for a number of hours. And I didn't feel terribly bad, but I just didn't feel very well. And I went to work as normal, and about halfway through seeing my very first patient of the day at that time, I just felt like I was almost going to faint. And so I was able to finish that patient's encounter, and I just simply had to lie down on my own examining table and just take it easy. I felt better after a little bit, but my nurse came in and looked at my face and saw that it was about the same color as the sheet on the table. And she said, "I'm going to put you in a wheelchair and we're going to take you down to the emergency room." So I went down to the emergency room, and a colleague of mine saw me and then arranged for me to have an EGD, an upper endoscopy scope, and that was another friend of mine that did that. And in that process, we found that I had an area of inflammation in my esophagus, which is the tube that joins the mouth to the stomach, and there was actually some bleeding going on there. And when we checked my hemoglobin level, it was kind of low. In fact, it was getting a little bit concerningly low, and then we checked my iron level, and my iron level was quite low, so I was iron deficient and anemic and lightheaded, and so they almost considered maybe I would need a blood transfusion to be able to treat this. I didn't need the blood transfusion, but I took iron for quite a long time after that to recover the anemia, and I was then on much higher doses of omeprazole for a while. So I refer to that as NCAA Division I heartburn, because that's a rather unusual case where somebody develops not only esophagitis, but bleeding and anemia and iron deficiency and lightheadedness and, gee, I wonder if we should transfuse you. That's pretty severe gastroesophageal reflux disease. So a few years ago, I became familiarized with some of the literature that looks at the anti-inflammatory diet or various anti-inflammatory dietary methods. And one of these was a thing that I'd never heard of before, and that is that a lot of the grains, that is wheat and corn and rice and oats, can be highly inflammatory. And this was a really novel concept. I'd never heard that before. I knew these were high carbohydrate foods, and so if someone was wanting to eat the ketogenic diet or the low carb diet, what long ago was the Atkins diet, you had to avoid these grains, but it was because they were high in carbohydrates. And I never thought that there were other things that are part of these grains that actually caused inflammation in the intestine. But the author that I was reading, Dr. William Davis, talked about that and went into great detail. It was just a very intriguing idea. And I thought, well, I need to lose some weight. I was probably about 30 pounds heavier than I am now, and that was a problem. And so I thought, well, I'm going to start implementing some of the things that Dr. Davis was talking about. And that included going on a very strictly grain-free diet. So I started that off not eating any wheat or rice or corn or oats, and I would avoid even corn syrup in things. I would avoid supplements that had rice flour in them. I was very excited to see a cauliflower crust pizza one time, and I thought that I'll buy that, and then I looked at the ingredients and it had rice flour in the topping, and so I put it back in the freezer section and left it there. So I was really quite strict about not eating any grains of any kind or any of their derivatives. And the thing that was interesting is not only did I lose about that 30 pounds over a period of, I would say maybe 4 or 5 months, so it was a slow weight loss. But not only did I lose that 30 or 35 pounds, but I also discovered that my heartburn was astonishingly better. And in fact, that was a number of years ago now, and although I still have a little bit of heartburn occasionally, generally it depends upon what I might eat or drink in the evening. And then if I lie down, then I may get a little bit of heartburn during the night. And I have a bottle of liquid antacid that has been next to my bed for probably 40 years, because that kind of thing happens every so often. But unlike previously, now that is essentially my only treatment for my heartburn. And it really doesn't exist much at any other time. And considering how very severe my heartburn was at the very beginning of all of this, and leading to this anemia and iron deficiency and maybe even needing a blood transfusion, being off of omeprazole 40 milligrams twice a day, which is a very high dose of that medicine, and now I do not take that at all. And the only kind of heartburn treatment that I use is just this as-needed stuff, that if I would simply pay attention to when I lie down and when I eat and what I drink, might not even be a problem either. That is just an astonishing occurrence. And so from my own personal experience, the idea of grains reducing the inflammation in the intestine, and of course the esophagus and stomach are part of the intestinal system, but the idea that grains could reduce, or withholding grains could reduce that inflammation, I have personal experience with that. And I've had a number of patients that have been willing to do the same thing for themselves and have really experienced quite remarkable benefits. Although the gastrointestinal inflammation in my case was associated with gastrointestinal disease, that is, symptoms that involve the gastrointestinal system, we know that the gastrointestinal system inflammation is actually not just isolated to it, but it's also transmitted elsewhere in the body. And this includes the central nervous system, so things that might include attention deficit disorder, depression, anxiety, potentially even autism. Those kinds of things, a grain-free diet can be a benefit for those. It's very common that grains are associated with inflammation that is transmitted to the blood vessels, and that contributes to coronary artery disease and other artery diseases. And in addition, it's not uncommon that people who are on a grain-containing diet will experience more musculoskeletal pain. And we have a number of patients that have basically gone grain-free, so to speak, and now they find that their generalized muscle and joint aching is quite a bit better than it was before. And it can also reduce some of the autoimmune diseases. So people will find that their psoriasis or their psoriatic arthritis may get better or completely remit, go into remission utterly. The same can sometimes be found with rheumatoid arthritis or lupus, or even very scary diseases like multiple sclerosis. It doesn't mean that these are the only kinds of treatments that are available, but it's important to remember that not all of these autoimmune conditions or these other cardiovascular or musculoskeletal conditions have to be treated with medicines alone. They could be treated in some way with lifestyle change. And so trying this, even though it's hard, and some people say, oh, I could never do that, it can be a very fruitful exercise. And so thinking about this is not without warrant. And I think that it's reasonable to consider it for any number of medical conditions. Maybe start with lifestyle first, get that as well controlled as possible, and then use other methods to treat these conditions if there's anything left. But it's really quite remarkable how often these things either go away altogether or substantially improve, maybe to the point that medicines that were previously used maybe aren't even necessary anymore. So it's not a crazy idea to think that maybe the grains that we eat today are kind of part of the problem. And because of the argument that people will give me, well, what about the people that ate grains thousands of years ago? Well, we have genetically modified our crops today to produce larger yields, and that has enhanced some of the genetics of these plants so that they grow bigger and you can get more of the product out of an acre of land. But simultaneously, this has done away with some of the genes that might have coded for anti-inflammatory components of these foods. So those inflammatory components were always there, but they were blocked or mitigated to an extent by some of the anti-inflammatory components. And now we have genetically modified these foods so that the inflammatory components are completely overbalancing the anti-inflammatory ones, which have been mostly bred out. Now, that doesn't necessarily mean that our foods have been genetically modified intentionally to hurt us, but they've lost some of their genetic variation that was originally in the plant. And what that does is it changes the balance of other components in the plants, not just the food value. So I think that that's probably the best explanation, at least in my mind, as to why this wasn't so much of a problem 1,000 years ago, but it certainly seems to be a problem now. So I would encourage you to learn more about this. We have some items on our recommended reading list that talk a little bit about it. Also, we have healthcare coaching that helps people understand more about these dietary changes and how they can help themselves with lifestyle change. And we'd invite you to investigate all of those kinds of things. Thank you for listening.